All right. I think we're ready. So, good morning, Charles. Thank you so much for coming to speak with us today. On behalf of the students and staff at Georgia Tech, I want to just say, welcome home. And thank you again for, for being here today. So, before I dive into some of the great things that MedShare has been able to do, locally and internationally, I just want to get to know the man who stands right here before us today. So I have a couple of questions just about your background, and really just want to get to know about you. So I know that your degree here was in chemical engineering, and your career spans from chemical engineering all the way to philanthropic, outreach. And so with that, I just want to say that my favorite part that I've learned about you so far is that you're from Atlanta, and specifically from Southwest Atlanta, where, the best side of Atlanta. So I recently read that you had you talked to Voyage ATL. And in that discussion, you mentioned that everything is possible and nothing is easy, So I wanted to hear about how your experience growing up in Southwest Atlanta, shaped your career, like your philosophy on everything being possible, but nothing being easy.
No, thank you very much, Ashley. First of all, thank you for having me. It's always nice to come back, on the campus. I always remind people that when I was in school here, this didn't exist. So this is quite a treat. That phrase, anything is possible, but nothing is easy. It actually came about when I was living and working in China. Wow. And that's how we explain getting things done in China, because you can do anything, but boy, it was not easy. And so once you figure out the best way to get it done, you can make anything happen. But yeah, you meet a lot of people here. Not many of us are actually from Atlanta. You'll probably notice that. I grew up in an area called Southwest Atlanta. It's over in the West End neighborhood, which is very different than what it is today. But I think that experience and growing up in a really, tough neighborhood really shaped me. It increased my fortitude. It allowed me to do some great things in the community, being active in the boys clubs. I was actually mayor of the Metropolitan Atlanta Boys Clubs growing up. So got a very early start. So I would like to think that was my start and being able to go from high school, public high schools, and then on to Georgia Tech at a time when there weren't very many, people of color at Georgia Tech at the time. I think is nothing but a blessing and a miracle that was able to happen for me. So I'm very, very proud of that, and I don't take it lightly.
Yeah, thank you. Thank you for sharing that. While you were at Georgia Tech, were there any clubs or organizations that you were involved in that you felt really helped to shape your career trajectory? Maybe something that you started. I know you mentioned that there weren't a lot of people of color. Yeah. So were there any experiences that really helped to stand out?
Yeah, we didn't have a lot of clubs, but I mean, obviously, I was a member of Society of Black Engineers. We had GT AAA, African American Association at the time. But I think the one that I was most proud of, it was in the early years of OMAD, the Office of Minority Education Development. We started a Big Brothers Big Sister program here to help minority students that were coming on campus get acclimated, give them an upperclassman. We made them with an upperclassman, someone that they could talk to, just help them with that journey. So I was very proud of to be on the early stage development of that program here on Tech's campus.
Awesome. Thank you.
Don't know if it still existed, but again, this was many years ago.
Yeah. Well, I think that's great. And I think it definitely speaks to how you have been able to grow and professionally and really continue to outreach to people in need as well. So I want to just ask a couple of questions as well about MedShare. So as we know, every great organization starts with a really great mission. And MedShare's mission is one that is, just so aspirational. So it's, if I'm not mistaken, it's doing well while doing good. Is that correct? So
that's certainly our calling, but our mission is real simple. It's to improve the quality of life of people on our planet.
Sure.
And so in that, you hear two things. You hear our strong care for the environment, because most of the things that we repurpose, we're saving from landfills here in the U.S. That's the sustainability aspect of it. But the part I'm most proud of is the improving the quality of life of people. And we do that, we always say where there's healing, there's hope. And so to give healing to these communities that would have nothing in some cases provides just tremendous hope for their families around the world. And so that piece of our mission really speaks to me. Yeah. And that's what it is today. It didn't start that way, and we'll talk about that later, but it has evolved to our care for both the community and to address health inequities around the world.
Sure. Awesome. Well, with such a great mission, I'm sure there's infinite opportunities. And the reason why you are so drawn to the organization is because they have such a great mission. But could you tell us a little bit more about why you decided to join MedShare from your long career at J&J?
Yeah, so just to fill in the dots. So I left Georgia Tech. I actually started as a process engineer, chemical engineer up in Goodyear Tire and Rubber Company doing some very nasty stuff. I discovered that all the neat chemicals had already been discovered. So everything we were coming up with was pretty nasty. And but it was all for the tire industry. So I did that a couple of years before joining Johnson & Johnson, actually up in Cornelia, Georgia, as a process engineer doing polymer research and doing a lot of design and development work for sutures, primarily wound care devices. And so that was pretty much my year, a 23-year career with J&J at various levels of the organization. Tremendous career. My desire to join MedShare did not start out with me sitting down one day deciding that I just wanted to give back. That sounds great, but that's not what happened. I think as family commitments change and things like that, and you look at the next phase of your career, what was clear for me is that I didn't want to keep traveling. I had worked in Mexico, had lived in China, had covered Asia. I was really on the go quite a bit. And with a young child, you as a parent, you want to make sure they have a degree of stability. So the decision was made to settle down in the Atlanta area, which was my home. And so I began to look for companies that were continuing to do good, that were in the healthcare space. And I ran across MedShare and found this wonderful organization that was repurposing, medical supplies and equipment to save lives around the world. So they had me. I mean, I was, in true confession, it was a COO position. I told my wife, she thought I had lost my mind. She said, what? To join a nonprofit, again, because I was an executive with J&J. But I tell you, I have not looked back. It's just been one of the most extraordinary journeys that I've ever encountered. And I've met some incredible people. So I would echo what you were saying behind every great organization is a great mission, but I also subtitled that they're great people. And so just been very fortunate to work with a lot of great people, meet a lot of great people, and be able to take the skills that I learned in the for-profit sector and use those in the nonprofit sector has been, I think, key to some of the things we've been able to do.
Awesome. Well, thank you. I know you mentioned that you joined MedShare as the Chief Operating Officer and then moved into the role as CEO, but you moved into the role as in 2014, which is, one of the most significant periods in time within the healthcare space. So there was the Ebola epidemic. Could you share a little bit about how you handled the strategy around being able to meet the needs during that pandemic, and then how that strategy evolved during the COVID-19 pandemic as well?
Yeah, so backing up a little. So MedShare, well, first of all, we're going to be celebrating 25 years this year. So I want to put that out there. But MedShare was founded on the principle of bridging the gap between surplus and need. And so that was our mission for until I became CEO. And it was a great mission, but it just spoke to how we did things. And my passion was more of answering the question of why are we doing this? And so that evolved to, the focus on the quality of people in our planet. And with that, we evolved to being a lot more programmatic. Up until that point, we would ship containers around the world and hope that they do good. And again, trying to answer the question why, I wanted to have some distinctive around maternal child health, primary care, infectious disease control and prevention, disaster relief, so I could better prepare the organization and to focus in those areas. So certainly when Ebola hit 2014, tremendous outcry around the world, particularly in Sierra Leone, Guinea, Liberia, where was the epicenter. And we were very poised because we had a program in disaster relief as well as infectious disease control to partner with those communities to provide a lot of PPE. which is what we did. We wanted to protect the healthcare workers. We wanted to protect families, and we wanted to understand the dynamics that were, leading to such an outbreak. And so, we shipped what was over 33 containers to those three countries. And I did have a chance to go back to Liberia after after Ebola was over, and the community was just very appreciative. And we began to talk about not if, but when the next, issue happened, would we be better prepared? So that focus, I think the fact that we had programs, we could focus in an area, we had partners on the ground, allowed us to be very successful. Now contrast that, with coronavirus or COVID-19, very different. It started out being very much the same. I recall, I think late 2019, the first request we got actually was from China. Mm-hmm. And because that was where the outbreak started. And so, our method is, let's see if we can help address it at the where it happens. And so we ship, millions of PPE over to China, particularly masks and things of that nature, to try to support those communities. But as you know, it was not contained. It got out and it hit the United States. So for MedShare, most of our work up until that point had been international. And certainly we began to receive calls from our local hospital partners, which are the very units we would get product from. So we flipped our model. So I would say, during that time, we really focused on the U.S., our community partners, whether it be safety net clinics, the hospitals that needed PPE. And a couple of reasons for doing that. Number one, the need was there. But two, if you recall, they cut off all our international supply for a while. And so we couldn't get things out to a lot of those communities. So we focused very heavily on that, very successful. Over 200 healthcare institutions, we provided, 5 million pieces of PPE, across the board to those communities. So we were very fortunate to be in a position. We didn't shut down like most organizations. We worked right through the pandemic. We masked up and welcomed the vaccines when it came. The one area we lost it, which caused us to pivot too. Up to that point, we used 20,000 volunteers a year, 20,000 across three facilities. As you can imagine, the numbers dwindled down to 7,000. And all of a sudden it was nothing. So we actually had our staff, jumping in, doing things we would normally have volunteers, sorting boxes, putting things together just to make sure we can keep things going. So I often talk about the resiliency of our staff and being able to do that during that period of time. But those are two different, I guess, examples of our model, the nimbleness and the flexibility but it was all, I think, made possible by the resiliency of the people we have, working in the organization.
Yeah, well, we're certainly grateful for your staff for helping during those times. MedShare has such a unique list of donors, and one donor in particular seems, particularly magical. So could you talk a little bit about your experience working with Disney as a partner and some of the great innovative things that they were able to do during the pandemic?
Yeah, I get that a lot. People see we work with Disney, they go, "Oh, Disney, how does MedShare and Disney?"
Yeah.
And I'm glad I mentioned China because it actually started there. There is a Shanghai Chamber of Commerce in which we've got Coca-Cola, a lot of the multinational companies doing business in China began to talk about MedShare and what we were doing. So our first support came through Coke and wanted to provide PPE to some of their partners, and we did that. And Disney, who was also a member, heard about us and said, "Hey, we have some funding. Can we just support your efforts because our park is closed down?" And and so that's how we started. And they were very thankful. Then they came back to us and said, "Hey, we've got another idea we want to run across you. We've got these. We've gotten a lot of requests for protective wear, and they're requesting our rain ponchos." Of all things. And this is particularly in the Northeast hospital. So we actually started out saying, "Hey, can you guys distribute rain ponchos?" And we did. We got over 200,000 rain ponchos with Disney characters and distributed to the nurses in hospitals around the United States. And they couldn't get enough of them because at that time they didn't have the gowns. So that's how it started. And so with that, as COVID-19 continued its prevalency and we came together again and say, mask seems to be a key component of the protection strategy. So Disney said, we're going to make masks, but we want to partner with you, MedShare, and two things. We want to donate the first 1 million masks to you to distribute to vulnerable communities throughout the United States. And we'll give you $1 million to do it, right? And so we came together with Disney. What an incredible partnership. They kept their words, all these Disney characters. So you can imagine it was hard enough getting small kids to wear masks. But when they saw those Disney characters, they wanted 2, they wanted 3. And so we set out on this journey. We partnered with the school systems in Atlanta, a lot of the boys and girls clubs. We hit schools, we hit everywhere where people had trouble purchasing masks for youth. I think we had a presence there. One of the more incredible places were up in Oklahoma. We went on to some of the native reservations and helped protect kids and youth that were cut off from medical facilities. So that was very moving for me. And also we made sure we addressed a lot of the disability care centers, again, where you had vulnerable populations and provided masks. So that was that partnership. It truly was magical. And we presented our Bob Freeman Humanitarian Award to Disney last year up in New York, and they were very appreciative of that. But they're just an extraordinary organization. I was very thankful that they stepped up in that way and cared enough about the communities here.
Yeah. Well, thank you. I think you touched on a really important point as well, and that was kind of about rationing supplies. So as you know, there was a lot of need during the pandemic, during the COVID-19 pandemic, that required a lot of different, a lot of hospitals needed things. Talked about like nursing facilities, all of these different organizations needed supplies. So how did MedShare approach rationing the supplies that they had at the time? Yeah,
so our whole model is set up based on the scarcity of supplies. At the same time, you have pretty much unlimited demand, right? I mean, you think about there's endless amount of need around the world, and we only have a limited quantity of supplies to provide it. So our model is inherent in addressing that issue. But I think, and one of the unfortunate parts of nonprofits is everything is dependent on fundings. I say that in jest, but it's just reality. So a lot of times where there's funding, a lot of our donations are directed there. And so we're working very hard to decouple that, where we know where the need is. So if we can raise what we call unrestricted money, then we can identify the need and make sure the need is given and not just where they have the funds. So we did quite a bit of that. In our model, it takes 3 things to happen. It's the product, we call it MedShare Magic. We need the product, which we get from hospitals, direct distributors, individuals. So we get upwards of 1.5 to 2 million pounds of stuff a year that we're keeping out of landfill. The other piece I mentioned are the volunteers. And I mentioned we usually use 20,000. So we encourage people to come in and volunteer to help. And what the volunteers do is they put the product in our database and make it available to our recipients. So it's sort of like eBay. So this sets MedShare apart. So we don't just put things in a container and ship it. We give our recipients a unique password, and they go online and order exactly what they need to fill a container. And why do we do that? Number one, we want to make sure we're giving these communities what they need and not what we think they need. And so that model has worked very well. And the third thing is the funding. Sure. And so part of where we decide to send product is based on, product availability, matching up with the need of that community, and also where we have funding. And so inherent in our model, again, is just based on scarcity, because we can never get enough supplies to meet the demand that's out there.
Sure. Thank you. Well, you once stated that, you once stated that MedShare truly believes that your job is not to give fish, but to teach communities how to fish and sustain without you. So could you talk about how MedShare does support communities after the donations are made, such as providing medical equipment that needs electricity in areas where there may not be a constant stream of electricity, or helping to make sure that communities know how to use the equipment that's given to them as well?
Yeah, I mean, I mentioned some of the programs we had. I failed to mention that one of the services we order is biomedical equipment, training and repairs. And the students from Georgia Tech actually participated in that. Students for here has helped us develop troubleshooting guides, for example, for a lot of the equipment that we're shipping that we can provide a pictorial troubleshooting. Students have helped us as part of Engineering World Health come over, help repair beds. They've come over. So we've had in other schools too. But I said that to say is one of the things that MedShare does is train end users, engineers, on how technicians on how to properly maintain this equipment. And by doing that, you can keep the equipment in use and continue to save lives. But also, part of our model is to be budget offsetting for these communities. So if we're donating supplies, which is the largest expenditure, I would say, in a hospital behind personnel, then they can free up cash to invest into the health system, right? Whether it hire another nurse, purchase another piece of equipment, but it's all trying to drive long-term sustainability of that community. So that teaching fish instead of teaching them to fish instead of continuing to give them fish is really having this be a short-term relationship. We don't want an endless connection to the same community. We're hoping to be a stopgap that allow them to generate revenue for the hospital, develop systems and practices that we help them with, and then we're on to the next community. So that doesn't always happen, but again, we at least put the framework in place where we are freeing up money that they can reinvest in that health system.
Awesome, yeah. Thank you. Could you talk a little bit about the current support that you guys are providing to Ukraine?
Yeah, I mean, first of all, my hearts and prayers go out to the people, in that community. MedShare, we typically don't even get involved in active war zones, and certainly don't take sides in wars. But where our heart is in the people that have been impacted. So if you can imagine, back in almost a year to the day, I think it was February 28th when the initial incursion started, and you had tremendous amounts of people displaced from homes. You had people hurt, and that continued to go on. So we certainly couldn't stand by and just watch that. So we did partner with a number of organizations since that time. To date, we've delivered over $12 million worth of humanitarian aid in support of that region. It's been everything from wound care types of products, dressings, sutures, you name it. And most recently, we made an $8 million donation by way of Johnson & Johnson, I hope. They gave us $8 million worth of orthopedic sets that could be used for some of these traumatic situations that were happening. And so I want to recognize one group in particular we work with called Razom for Ukraine. They have just been extraordinary. We have partnered on so many interventions. And also, we had a project here recently with Henry Schein to produce hygiene kits that we were able to deliver to these communities. And they were delivered via motorcycles, vans, buses, trucks, you name it, just to get into a lot of these communities where kids and elderly people were. So we continue to provide help. We've shipped over, I think we're over something like 37 shipments we've made. And we also provision what we call these medical mission teams, people that are going to the region to provide help. And then, of course, you guys just heard the earthquakes just hit, Turkey and Syria. And so we're back to the drawing board there, huddling and trying to figure out what we can do to support that. So our model, we're not first responders like Red Cross. Where we do our best work, I think, is doing that after the rescue. When you get into most of the recovery and rebuild phase, we can come in and help rebuild those health systems where we can. But we do get in on the early stages, providing some of our critical medical supplies to those medical professionals that need it.
You've mentioned so many great things about MedShare today, and I know there's a lot of people in the audience who are also equally excited as myself to learn how we can donate or get involved with MedShare. Could you explain a little bit about how we can make donations or how we can get involved as students?
Yeah, I mean, www.medshare.org. You could go there. You can read more about MedShare. Certainly, you could donate. We welcome the donation, but we have volunteer sessions. Also, you can come by and volunteer Tuesdays through Saturdays. First shift is 9 to 12, and then we do another shift from 1 to 4. So go online and sign up for that. And we've had that, and we've done with the Scheller School. We've partnered with some of your MBA students to have projects, looking for projects to work on. we've provided opportunities and continue to do that. So just some myriad of ways. And even, well, I would say, even if it's not MedShare, I mean, find an organization that you love and are passionate about, and just, give your time, give your energy, give your effort. We always talk about time, talent, and treasure. So I think where you can, figure out which bucket you're able to contribute and go all in on it.
So thank you. Well, Charles, it's been a pleasure. Those are all the questions that I have, but I don't want to hog the time from the audience. Okay. So I think we want to turn it open it up to the audience to see if there are any comments or questions from the team.
Yeah, it's Q&A time. So if you have questions, just raise up your hand. And for those of us joining this talk virtually, you can ask your questions by dropping them on the chat box. So we'll read it out and get your questions answered. Okay, we have one question here.
Hello, my name is Peyton McClarty Jones. My question is, what is one of the biggest challenges faced by MedShare?
Yeah, so the question is, what is one of the largest challenges? I think, well, let me just say, in general, for all nonprofits, it's always funding, right? So every year you come in, you have to fundraise. And I think doing that amidst a pandemic and also the economic downturn that we're seeing, the talks of potential recession. So it's just a lot of noise out there. And then you've got donor fatigue. A lot of people gave toward COVID, so people are really tired. So I think continuing to raise money with that backdrop is always a challenge. But I think besides that, we went through the same, what did they call it? Great resignation, where people decided were making decisions on where they want to work. And so we went through a phase of that, turnover. And but we worked through that. We've got a tremendous team in place now of people that chose us in the middle of the pandemic. So it had to be a place that they wanted to come and work. But also just keeping pace with that. And I think with any, and this is a business principle, you always want to make sure what you do remain relevant. And so I think for MedShare, we just have to, we know that our model is relevant, but we need to make sure others know that it's relevant and continue to aspire to do greater things. And we want to certainly keep position organization to provide more care to more people around the world.
Thank you. More questions. Okay, let me give it to you.
Hi, my name is Taylor. I'm an undergraduate business student here. And my question for you is, you have your degree in engineering, but now you work in the public health and business sector. So are there any similarities that you've noticed between engineering and public health, or engineering and business, that really, pique your interest in doing both of those things throughout your lifetime?
Yeah. Well, first of all, hello, Taylor. Yeah, I think tremendous question. And I didn't understand it when I was taking engineering classes at the time, but our professors used to always talk about, these are discipline courses. And I think I kind of understand what that means is if you can go through that rigor, you can apply that to just about anything in life. But I would say, for me personally, is that I treat everything like a process, which is a basic engineering principle. And so we look at inputs and outputs, even to the point when we laid out the programs. One of the things we wanted to do is lay out what we call these logic models, where you have your inputs, you can measure your outputs, you have your outcomes, and you have your impact. And I think thinking of things that way allows you the opportunity to figure out how you can improve it. So make it a continuous improvement, type process. So I would say that, and for me personally, having worked for J&J for 23 years, I was just indoctrinated in so much healthcare. I had the opportunity to go out and even train surgeons on how to, use our products and things of that nature. And so having to study a lot about physiology, anatomy, and so that was kind of rooted in me and doing design work. But I would say treat it like a process. That's my life, really. It's like most engineers, everything's a process to us. That's how we look at it. But when we say it's a process, it doesn't mean that it's stagnant. It's just that you're always trying to continuously improve it. Right, you're reading more things, you're learning more things. So that's been life for me, and that's how I've tried to approach MedShare as well as when I was doing. I was a vice president of supply chain operations for J&J company making medical products. I think it's been the same. It's been the same for me.
Thank you.
Sure.
Thank you. Thank you.
Hi, my name is Brenna Cheney. Measurable outcomes were measured in your introduction, so I was wondering how MedShare measures the impact of the work you're doing and then adjust based on that.
Yeah, and I just touched on it. So one of the things we were able to do is create an algorithm for calculating people served, which is a key component. So what we recognize is that we couldn't measure outcomes on everything because you really need to be able to go in and measure your baseline and then understand all the variables coming in and which of those are associated with you, So, and what we realize, there's a lot of people that's involved in that care. And so at best, it's a collective impact. But I think having, understanding on the average, a container of a 40-foot container of over 1,000 boxes of medical supplies, 35 pieces of equipment, how many patients are you serving? And so we spent 5 years just detailing that aspect of it. And so applying that metric across container ship to be able to say, roughly 12,500 patients served times that, you can at least baseline on people served. And so for us, that baseline was about 2 million people that we were served a year. And I remember in 2020, I had an aspirational goal. I wanted to kick that number up to 5 million people. So 5 in 25, right? 5 million people in 2025, but COVID hit. So then I switched it to 5 million in 2026. But we'll see how that goes. But I think that's a key component. And the other part is, I think understanding the intrinsic value of also your inputs, measuring your inputs, whether that be your funding, your volunteers, your process, your procedures, your outputs, which are, maybe your containers and pieces of equipment, and then you can look at the impact when you look at physicians that you've equipped with these products, the people that you've served, and then maybe your longer term outcomes. You're going to look at the economic impact, perhaps on the health system. You're going to look at health outcomes, right? So one of the projects we're working on, where we're able to do it, is it's called a Safe Birth Initiative in Nigeria. We partner with the Ministry of Health, Coca-Cola, to upgrade prenatal, perinatal, and postnatal care for 15 hospitals, right? And so we knew what the infant mortality rate, maternal child rate, mortality rate was for that hospital system going in. Now, after the intervention, where we've upgraded a lot of their surgical equipment, we've upgraded their beds, we've upgraded a lot of things. We provide training to their engineers, their technicians. We revitalize old stock of equipment that they had in place. And now year after year, we're measuring what the outcomes are as a result of that. So that's the work we're talking about. And so in those cases, we can do it. One-off containers becomes very difficult. So we usually treat it at the output level. Yeah.
Okay, thank you. We have one more question.
She hit my sweet spot. That's the stuff I love.
Yeah. Hi, I'm Delaney Elder. And I wanted to ask if there was like a specific moment or something specific about when you worked at J&J that really made you realize that you wanted to continue working in the healthcare industry.
Yeah, I mean, it was, so I worked, first of all, I worked all around the world. And I think that was it. In particular, when I lived in Shanghai, China for about 3-4 years. And I would spend every other month in India. Doing work. And I tell you, I just saw firsthand the need. It was an incredible need. It was beyond anything I had ever seen in the US in terms of just need. And so that really wears on you, or at least for me. And I think Johnson & Johnson, we had a credo, which we talked about our obligation to give back to the community, to the patients, and lastly to the stockholders. But I think that, and so we were actively involved. So I ran facilities throughout India. Whatever we would do for the facility, I made sure we rolled it out to the families. So if it's something like we were promoting, bicycle helmets, we provided bicycle helmets for the whole family, right? If you were doing anything. And so that for me just resonated. And so I know I wanted to continue to do that. I truly believe that healthcare should be a given right, and it shouldn't be based on where you were born, what circumstances you are. But unfortunately, that's the world we live in. And so where we can get involved with that, COVID showed that. The world was surprised that we had all of these inequities that exist in the health systems here in the U.S., where you had pockets of poverty that people weren't near any health institutions. They were rolling out COVID vaccines where people didn't live anywhere near where they were rolling them out. So all these things just continue to highlight the need for the types of work we do. And one of the things we do, for example, is these safety net clinics here in the U.S. are providing critical care for underinsured or uninsured U.S. citizens. And it's just unimaginable. Now, I wish they would, continue to increase, Medicaid and things like that. But beyond that, I think that there is a need here right at home that is being unaddressed. And MedShare is working with those communities as well to continue that fight to make sure that they have a quality care, not based on where they were born, but that we can provide that same type of care to them. So very passionate about this work. It's just so needed around the world, and I don't think it's going away anytime soon, to be honest with you.
Yeah, that's good.
Hey, Charles. I know that you try to stick to your mission of development in terms of health outcomes, but stuff always happens that pushes you to the humanitarian relief side. And so on my mind today is, Turkey and Syria. And so what will MedShare be doing with the earthquake needs? And will it be a lot like you did with Haiti and other sites? And particularly if you can mention, how do you get stuff into Syria?
Yeah, so the short answer is we don't, but we get it into Turkey for sure. And Terry, Dr. Bloom knows too much. She knows all of this stuff. But humanitarian aid, first and foremost, we're a humanitarian aid organization. That's who we are. And in doing our work, we're certainly trying to drive, health outcomes. But as I mentioned with Ukraine, the work we're doing now, we're gearing up to support both Turkey and Syria with these recent earthquakes. So what we do is we're able to ship things to the border of Syria through Turkey and capture a lot of the refugees that are coming across the board. There's legalities that prevent us from getting directly into Syria, but certainly the people impacted as best we can. So there's a couple of Syrian organizations we're partnering with. We've got some early calls that's happening now to see what we can do to provide help. So I mentioned we're not usually first responders, but we've got a couple of, and right now, I don't know if you heard, but things are being impacted by the cold. It's actually snowing. There's a lot of things that are impacting the ability to get things in. But as that clears, we're going to be air shipping items over to those communities as well to provide help. And we've done that. We've long supported the refugees of the battles over there, and usually they come across Turkey. So we've got a few partners on the border there that we're reaching out to see if we can ship things there to them. My heart goes out to those folks as well, because the conditions there are just, and I heard I think Syria, I think this was the largest impact earthquake since 1939 or something like that. So it's been a while. And so Jason, who and the team, they're actually, working, he may be in here, but they're working on figuring out what we can do to respond. But we have a bit of a planning. One of the things and I didn't pay Terry to ask that question, but one of the things we have developed, because we have disaster relief program, we have what we call emergency response protocol that we go by that guide our ability to respond. We don't want to be one of those organizations, every time something happens, we put up a appeal on our webpage for money and then figure out later we can't do anything. So we're doing a lot of that early stage, reaching out, talking to our partners, developing a needs assessment, measuring the capability of what we can do. And then once we have that, Terry, we're gonna move and try to move very quickly to support the people there.
Hey, my name's Aditya Singh. I actually am an undergrad who works on health tech for safety net clinics.
Oh, good.
So your talk about sharing PPE with a lot of hospitals across the country reminded me, I was speaking to someone with the Rural Health Innovation Center at Mercer University, and they were talking about, there's a challenge whenever you're trying to do outreach and work with organizations in medically underserved areas, that there's a bit of skepticism that, you're trying to do a top-down approach, you're trying to force something that's not really suited to the needs of our community. Was that an issue that you've had to encounter with working with certain communities, and how do you overcome that kind of skepticism and get them to open up and figure out, what are the needs both ways?
Yeah, not so much the well, first of all of our products are unused, unopened, unexpired, right? So this is not, kind of excavating stuff that's trash. This is all quality, and in fact, we won't ship it if it's not. So that's number one, and we always say that up front so people understand this is first-rate product, not secondary product. But the issue we had was more their ability to get to our facilities, to collect the products, and so particularly during COVID. So one of the things we did, another shift in our model I should have mentioned, is we launched our community drive day, where we put together pallets of PPE and put the call out to all the safety net clinics in the area, and they just came by, and we were able to fill up, trucks and vans and things like that. And now we're working on funding to provide a van that we're going to go out to these communities to distribute the product, the PPE. And then the third thing I would say is we try to learn from what we were doing outside the U.S. and apply to the inside the U.S. So, for example, I mentioned that Safe Birth Initiative. So we found out in the Bay Area, particularly in Oakland, and particularly with women of color, the same terrible maternal child health metrics were prevalent there. And so we launched that initiative. We went to one of our partners and got them to donate, 10 ultrasound machines that we're donating now to those clinics to improve their pre-assessment, care for their patients as well. So, and these are all, top-notch equipment. So we haven't had that skepticism so much. It's just been, can we get there to get the products, and we're trying to address that. Yeah.
Thank you so much. We have lots of questions, but because of our time, we're going to just limit it to 2 final questions, and we'll round it up. And if you still want to ask questions, Mr. Charles will be around for some minutes, so you can still hang around and ask your questions even after the program.
Charles, I'm Bob Thomas, professor here at Scheller. And this is more of an announcement. Georgia Tech does have a campaign with MedShare to send a container to Ukraine. And we could really use the help of students and others to spread the word on that and see if we can get the money raised and get the container there as soon as possible. Thank you.
It's a good announcement.
Thank you. I'm an MBA student as well with Ashley. So my question is more about technology. So like AI, VR, a lot of new innovative approaches that can actually minimize costs and increase reach within the work you're doing. So have you thought about those things? And if so, like, is there anything that you're excited about that could possibly make a huge difference to MedShare?
Yeah, I mean, nonprofits aren't always on the cutting edge of technology, but I would say certainly with AI, I can give an example of where we're trying to apply it. And so one of our partners, this is a marketing firm up in New York, which has a representative on my board. So we always try, you heard of building a better mousetrap. Well, we're always trying to figure out what's the prototypical MedShare donor, right? So what does that donor look like? And so we're using AI to really go through all of our data and the donors that we have and build a profile of that donor and spread it out across the multiverse of people that fit that criteria, and then we're approaching them. I'm excited about that. So it's kind of as opposed to doing like a shotgun approach and say, hey, support MedShare. Well, here's a profile of the people that do support MedShare. And now how can you apply that profile across the spectrum? And it's telling us who these people are, and we're approaching them. So much more targeted. So that's a great example of how we're doing it. I think on another technology base, we are some of our shipping partners have technology where they can know where our shipments are at any time. RF technology that they're using. So they have dashboards that as we shipping, we can look and see where it is on the ocean and know when it shows up, you know, at a particular site. So that excites me. One of our partners, I remember visiting them, going to the headquarters in San Francisco. They're Flexport is the name of the group, and they touted themselves. First of all, when I walked in, I think I raised the average age by, I won't tell you how many years, but they said we're the first shipping company that was founded after the internet. I said, okay, after the internet, which meant their whole platform was based on the use of the internet and technology of that. So you say it's rare. Other companies that had to adapt, they were founded within that sphere, and so it was very technology based. So those types of things we're trying to use. I think the others we're looking at is how do we better communicate, you know, with our recipients. And so we've gone through, one of the things we did do is develop a technology strategy. For us at MedShare, we were housing a lot of things on our server. We had a very cumbersome inventory management system that would refresh every 3 hours and frustrating. So we did an overhaul of those type of things, doing more cloud-based technology, using more cloud-based storage and things like that, file sharing. So we've gone along that, but that's it, which is pretty cutting edge actually for nonprofit's sake in terms of ours. But because each time we do that, we usually have to go out and get like a technology grant or funding to allow us to do that. But I think we've been pretty successful. There's certainly a lot more we want to do. I think digital, we want to continue to increase our digital space and make use of technology. And one last thing, we also have working with us now, we used to call them the young professionals, but they're the immersion leaders group. So these are young professionals that are very technologically savvy, that are lending their expertise to us and coming up with these creative ideas. So I'm looking forward to that as well. Let's implement.